Hello and welcome to today's webinar. We're really delighted that you've all been able to join us this afternoon. So today we're focusing on the upcoming UN high-level meeting on NCDs and our work to raise obesity within that agenda. We've been sending out a number of emails over the last few weeks to all of our members and advocates to support our campaign, and we're really thankful for all of the engagement and involvement we've had to date. The aim of today's webinar is to bring everyone up to speed on our activities and provide an opportunity for you to ask any questions that you might have on our campaign or on the UN high-level meeting itself. We particularly wanted to hold the briefing this week as the civil society hearing ahead of the high-level meeting is taking place next week on the 5th of July and is a really great opportunity for all of us to get our voice heard. Also, the negotiations on the zero draft document, the outcome document for the high-level meeting start tomorrow. So there's loads going on at the moment on this exciting topic. Today we have World Obesity's Chief Executive, Johanna Ralston, giving us a talk on what the UN high-level meeting is and why it matters. And she'll be followed by Lucy Keatley, who will share details of our Obesity Planet campaign and how you can all get involved. Unfortunately, Robert Martin has had to pull out of today's webinar and he sends his apologies. However, we hope to have him involved in a future webinar, so look out for that. Before we start, just a few quick housekeeping things so you know how to engage with our webinar. Everyone should be muted at all times unless you are the presenter. So if you notice that you're not, please make sure you're muted. We encourage you all to ask as many questions as possible. We want this to be interactive and we want you to get as much out of it. Each presentation is going to be followed by about 5 minutes of Q&A. So please get your questions through to us. You can do this by clicking on the Q&A and typing questions into the question box and we'll be able to respond if possible. There is a handout of today's presentations which can be requested as a PDF document from Fiona and her details will be provided at the end. And just so you know, we are recording this webinar and a link will be sent out to you following the webinar, and so you can watch it back or you can share it with colleagues to share with them what we're doing ahead of this important meeting and what we're doing specifically on obesity. So our first speaker today is Johanna Ralston, who, as I said, is our CEO of World Obesity Federation, and today she's calling in from Geneva. She's going to be giving us some background to the UN high-level meeting and why this is so important. So over to you, Johanna.
Okay, so here we are. What is the UN high-level meeting and why does it matter? Let's go to the next slide, please. So many people on the call have heard this background, but I think it really bears repeating because it's important to understand how important it is to be around some of these tables, and this is a table that is at the World Health Organization where the executive board meets, and around getting our language into key documents. And those are two things that are really happening a lot this year. So it's an opportunity for us to potentially insert really important language about obesity as a priority into key documents and within the context of key meetings at which decisions and potentially funding and prioritization of health, including obesity, will be sort of discussed and committed to for years to come. So if we just go back a quick history, in 2001, and this is really looking at health in a global context. So with a particular focus on what are the most pressing global health issues that we've seen since the turn of the century. 2001, the Millennium Development Goals were approved by the United Nations. So all member states of the United Nations approved these, and these were goals that were meant to address sort of overall global development, including economic development. And within them, there were health goals around communicable diseases like HIV/AIDS and malaria and TB, and then also goals around maternal and child health. There was no mention of non-communicable diseases, cancer, cardiovascular, diabetes, chronic respiratory, and other diseases, including, as we know now, obesity at the time. And it was just, I think, a reflection of a misperception that those were mainly issues of high-income countries, which we all know now very much not to be the case. In 2006, there was a resolution at the World Health Assembly by the diabetes community, which was very helpful and formed the basis for what became the NCD Alliance and NCD sort of civil society coming together to say, let's not try to deal with these issues disease by disease, but let's say we have a series of diseases that are all affected by globalization, by sort of urbanization, global changes to diet, global changes to how people live and move, as well as the many infectious agents. So through advocacy, The member states, particularly those in middle-income countries, supported a UN high-level meeting on NCDs, and NCD Alliance and other NCD organizations, civil society organizations, including IOTF and IASA, which were predecessors to World Obesity, came together and helped to call for and have a UN high-level meeting on NCDs. In 2013, as one of the follow-up steps to that, a series of targets, and the next slide covers these in a little bit more detail, were adopted by the World Health Assembly, the governing body of WHO, and that included a zero increase in prevalence of diabetes and obesity to 2025. I think we can all maybe just mull over whether we've achieved that or not, and are on our way to, and I think we can all agree probably not. 2015, the next sort of generation of Millennium Development Goals, called the Sustainable Development Goals, came, and 1/3 reduction in premature NCD mortality by 2030, so 33% by 2030 was approved, and that included some language around obesity. There was also the UN Decade of Action on Nutrition, included goals around obesity. And in 2016, the WHO commissioned the Ending Childhood Obesity Commission, and they launched their report in 2016 and sort of specific targets, which were approved in 2017. Now in 2018, we have the UN high-level meeting on NCDs, which is the third one. There was a small one in 2014, but this is one to say, how are we doing? And I think the general consensus is we are not doing nearly well enough. Not nearly enough has happened since this whole notion was sort of pulled together and approved as a global priority in 2011. And also, universal health coverage is a big priority this year. There'll be a high-level meeting, similarly one that takes place at the UN at the time that heads of state and others outside of just the health community will participate in next year. But universal health coverage is a notion of that there needs to be a common kind of framework and right to health, just as there have been to other issues, including education. And so it's really health coverage as opposed to just health care. And the G20 has also taken on particularly childhood obesity as a priority in their own agenda, which they will be meeting in Buenos Aires at the end of this year. And then I think the question is, and we'll come to this, it's still still determining, do we want to move towards a resolution around obesity ultimately, as was done with diabetes, as has been done with many health issues, or a broader framework around obesity. Can we go to the next slide, please? Okay, so in 2013, I just wanted to mention these were a series of targets that were approved to 2025, but the Global Action Plan only runs 7 years for WHO because I think that it's a little bit hard to have a 12-year action plan when so many new factors will come into play. But these were the targets, and that included, as you'll see in the sort of in the lower around 5 o'clock on this map, diabetes and obesity sort of halt the rise of the prevalence of diabetes and obesity, along with other NCD-related targets and goals. There had been others, such as sugar, that had been considered and not adopted at that time. Now I think we're learning that issues like sugar do probably merit common targets. But the main issue, and one of the drivers for the high-level meeting, is that the world is not really on track to get to these targets by 2025. There's been political action, but very little resources and very little sort of alignment around these. So that's why it's so important that we all come together and push for these. Next slide, please. And again, Sustainable Development Goals, which were approved in 2015, as we know, number 3, which is pulled out in the center, is good health and well-being, ensuring healthy lives and promoting well-being at all ages. And under that are a series of targets, including this cut by 1/3 the premature deaths due to NCDs by 2030. You can go to but also some of the other targets, I should say, some of the other goals within the Sustainable Development Goals do affect and are affected by obesity, including physical space, how we're living, agriculture, under and over nutrition, which would be around target 2. So, and again, the Sustainable Development Goal 2 is around all forms of malnutrition. If we could go into the next slide. Okay, and then I think it's important to revisit the ECHO, the Ending Childhood Obesity Commission, and their outputs, which were approved last year, and which we're working with the World Health Organization on kind of a status report on how is it going with countries meeting these targets as well. And they're around these 6 areas, including weight management, promoting intake of healthy foods, physical activity, concentrated activity around preconception and pregnancy care, recognizing the importance of the first 1,000 days, early childhood diet and physical activity, and then health, nutrition, and physical activity for school-aged children. So ECHO we are working on a status report with the World Health Organization around how is it going? What are the appropriate monitoring frameworks around this? Sort of general agreement around indicators, and it'll be an opportunity, we believe, to reinforce that the childhood obesity agenda is the first, aside from the target on zero increase in the prevalence of obesity and diabetes, is the first really fully realized obesity sort of commitment by member states of the World Health Organization, the World Health Assembly. So that's where the commitment has really started, and I think it's a great opportunity for all of us to come together and support that agenda, as many of us are, and many have been very instrumental in even the development of the Ending Childhood Obesity Commission report. But it's the part of obesity that appears to be of most greatest political urgency, is what I would say. There's many ministers of health who are voicing great concern about this, and that's coming from them, and not even from their constituents as much as just from this general recognition that childhood obesity is a massive concern and issue in many countries, and that has been this transition from undernutrition to overnutrition in many countries as well. So this is an opportunity to really start to really get commitments around obesity in general, and especially achieving the goals and aims of the Ending Childhood Obesity Commission targets. Can we go to the next, please? So this year, there's been a number of activities this year and sort of in this latter half of last year leading up to this high-level meeting, and that's including the appointment of the Independent High-Level Commission on NCDs, which was appointed by the Director General Tedros in October for 2 years. So it's going to run through almost to the end of 2019. The initial co-chairs were Tabata Vasquez, who is president of Uruguay, and as many know, he's an oncologist and has been a very passionate health and NCD advocate. And Dr. Sanya Nishtar, who was co-chair of the ECHO Commission. She was also a candidate for Director General of WHO last year. She's a cardiologist in Pakistan and runs an NGO called HeartFile. So they were joined by 3 other co-chairs. Dr. Tedros, I think, felt it was very important that the biggest issue in a way around the fact that goals are not around NCDs are not being met was that there wasn't enough of that sort of head of state, head of government level of commitment. And that needs to be where the political concentration and action go. So there was a 20, actually in the end, I think 23 commissioners appointed to this commission. 1 or 2 representing civil society, a couple like Michael Bloomberg, who has been a big philanthropist as well as a very successful businessman in his own right. A number of sort of individual topic experts, and then heads of state and heads of government and some ministers of health. So the other co-chairs included the Minister of Health of Russia, the President of Finland, and the Prime Minister of Sri Lanka, for example, and there are a total of 5 heads of state or government on the commission. So they have their charge was to advise Dr. Tedros, the Director General, on how to accelerate progress towards the SDG target 3.4, and again, that's the reduced by 1/3 by 2030, premature mortality from NCDs, and make recommendations on how to ensure that the high-level meeting is a tipping point for the response to NCDs, because we're halfway between 2011 when the first meeting happened, and 2025, towards 2030 when we're supposed to be seeing a significant downturn in premature mortality. How do we operationalize commitments from the from this high-level meeting? And so I think one of the challenges has been that there's been a number of declarations and commitments made, but not necessarily operationalized out of previous meetings. So again, being very much it's not the what anymore, it's the how. And then the charge was to submit the first report to Dr. Tedros in June 2018, which just occurred on June 1st. We can go to the next slide. So before the June 1st report was launched, and that's that one on the upper right, there was a series of consultations that took place, and many of us in the obesity community were invited into those, some expert meetings and other gatherings, and then also an open consultation, which was open to anybody who had was able to register through the WHO website. So what we discovered was that while earlier drafts had spoken about the importance of addressing obesity, language around obesity was missing around the very, very first draft of this time to deliver report, which is what this commission was delivering to the WHO, saying these are our recommendations, which we want you to in turn deliver to the UN. This is this whole political process. Remember, the WHO is the health agency of the United Nations, so the high-level meeting is at the United Nations rather than WHO to reinforce the importance of not just ministers of health, but heads of state being part of this. But that means that everything sort of goes recommendation to recommendation to recommendation. None of these are binding for the UN to have as its political declaration that it has heads of state sign off on in September at the meeting. I hope that's clear, and I hope it relates back to probably some of the national policy work that we've all done, where this is sort of going to sort of ever higher levels, but it's the equivalent of going to the Prime Minister's office to have them sign off on something instead of it being solely through the Minister of Health. So the first draft of the report included no language on obesity, and we were very concerned about it. It included language around nutrition, physical activity, first 1,000 days, but did not include language on obesity. So we took that as an opportunity to come up with language and say it's very, very important that obesity be prioritized and addressed in this. And that in that consultation period in May, our members joined forces and submitted common language around obesity. So we want to just again thank so many of you who did participate in language at that time. We all sort of signed on to the open consultation period and submitted language. And there was, I think, over 200 different contributions from all across civil society as well as the private sector in terms of comments to the draft document. And out of that, the community that was the single largest representation by any one community was by the obesity community. So I just want to say thank you. It was noted, and our language made it into this time to deliver document and into the latest, the first draft of the UN document. So thank you. This is how it works. All of us, many different organizations coming together around common language. Doesn't have to be exactly the same, but if we have sort of common principles, it works really, really well. So I just want to thank everybody again. The report was launched on the 1st of June. You can see, well, that was a picture of the launch down on the right here in Geneva at the World Health Organization. So that was really exciting to be part of all of that, and it was a really great day. I think there was a couple of really positive things about the final report, very much making it about the importance that heads of state, not just ministers of health, support this, that this is a very, very high level urgent problem, importance of civil society, the importance of accountability, so that this isn't just sort of another example of we made commitments and then did nothing to fund or deliver on them. And then the comprehensive nature of the report was I think greatly appreciated, because we all know, just as we very much know working in the obesity space, a comprehensive multi-sectoral approach is critical. We cannot do this silo by silo. A couple of the weaknesses were there was very little on sort of people living with NCDs, including obesity, and the language was very strained. And that's something that I know I personally and many of us had pushed for stronger language around not just sort of people-centered, but in fact people-governed in some ways, and having people affected by the diseases be part of the decision-making, understanding that people living with obesity and other NCDs actually have a great deal of expertise, knowledge, and insight into the realities of treatment, of management, of prevention, of the challenges, and that it's very important that those be incorporated. That was not particularly that was sort of not very present in the final report. The other was stacks, which is sort of sugar, tobacco, and alcohol tax, being seen as kind of an approach that can be very effective to address NCDs in general. Taxing is not perfect, but if you put taxes on these products, you first of all generate revenue, but you also, it's been shown it definitely reduces consumption. whether it's excise or sales tax, it's definitely a positive. In the case of sugar, which is a more recent, particularly around sugar sweetened beverages, we're seeing now there's, I think, 30 countries that have some form of legislation or policy around taxes on sugar sweetened beverages as a way to reduce consumption. Unfortunately, and it's been quite openly known now, there was one of the commissioners who kind of vetoed language around sugar sweetened beverage tax, saying it was a good buy, not a best buy, which is sort of WHO language, that there wasn't enough evidence. However, I think there was a general feeling that there was probably more to it than that. We're not exactly sure what happened behind the scenes, but the U.S. really did not allow language around sugar sweetened beverage tax to be included in the final document. However, there is advocacy now around the importance of taxing soda and other sugary beverages as part of an approach to address NCDs. And I think for our community particularly, it's a very important issue. So we've issued statements. We thank all of you for many of you who've echoed those statements, saying, expressing concern that an approach that actually is not that generates revenue while also curbing consumption should not be included. Can I get to the next slide, please? Thanks. Okay, great. We've also been doing advocacy a lot this year, and I am working with many of you. These are our colleagues in Mexico, and I want to point out, I hope Donna Ryan, if she's on this call, does not get angry at me for putting a funny picture of her in front here, but that's Donna covering her eyes here. We were in Mexico City with Simone Barquera, our colleague, and our colleagues from Mexico, including colleagues from the Ministry of Health, and talking about the importance of Mexico's leadership in sugar sweetened beverages, but also how their obesity work can be, in some instances, a model for other countries, and how important it is that they will be having an election coming up, and that their head of state, we hope, will be able to come. This happened to take place on the same day as Jamie Oliver launched his Add Enough campaign, where he said the premise, I think, as many of you know, is that the only way to avoid marketing of sugary snacks is to close your eyes, or to cover your eyes, because they're everywhere. They're so pernicious and omnipresent. So this is the Add Enough campaign, and it was fun. We sent that into the Jamie Oliver Foundation, and I think they tweeted this out along with many of your pictures. Can we go to the next slide? So some of the advocacy work that we've been doing has also been about really trying to elevate the profile of obesity in the media. We happen to be at a time when there's great interest in the issue, and I think we're trying to help do what we can to drive that, but we're also fortunate that there's just in general, I think, a massive recognition that this is a pressing health problem that just has not received enough attention before. So these are just a few of the examples of the media that we've been working to generate, and working alongside many of you. We know that recently the ASO Congress had excellent media coverage, both around some of its studies and around linking sort of to the wider policy agenda that's underway. The New York Times had done a series around this and had printed one of our letters to the editor, which we were pleased with. We also have a campaign, if you've not seen it, under our microsite in support of the campaign around the World Cup, because we're trying to make the point that countries are, even the countries that are in the World Cup, of which there are now only 16 remaining, many of them, most of them have rates of overweight and obesity that are well over 50%. So while they may be, part of the beautiful game, there's a lot of their population who are also being left behind. So again, we're trying to find every avenue and opportunity to get attention for obesity, because we think the more decision makers and others see it in the media, the more we create that kind of sense of urgency that will translate into political attention come September in particular. We can go to the next slide. So this is just a very quick summary of some of the political steps. So again, in January, we had the UN Secretary General's progress report on NCDs. So that was coming from Secretary General Guterres, as opposed to, again, elevated, making it a UN issue. And that's where he was very pointed in his language, saying not enough is being done, that commitments, we're not meeting commitments. We're talking about diseases which kill, something around well above 2/3 of the world's population. They're no longer diseases of the affluents, and obesity is very much a factor in all this, and yet it's not enough is happening. That was an important first step. Meantime, Bloomberg himself launched the Fiscal Policy Commission on Health and NCDs to say what are some different fiscal measures that can be taken to address NCDs, because they, unlike some other health issues, have a complex relationship with trade, as we all know. So addressing it in terms of fiscal policy has very important kind of implications. So these are, again, some of the activities, the modalities resolution for the high-level meeting saying what day it would take place on. There had been pressure from some countries to hold this high-level meeting in the summertime, in the north, I should say, in July, which we know is the sort of the kiss of death, because there's just, most people are away. So we felt it was very, very important to have it at the time of the UN General Assembly to ensure that there would be heads of state, and that it would have the high profile of being associated with the UN General Assembly taking place inside the UN. And this is the case, which we're very pleased about. It's September 27th. Next week, there's the interactive hearing with civil society and the private sector. That's on July 5th. And we're delighted that a few members are able to join, including I think our colleagues from Brazil and India are able to come, and that's excellent news from us. The zero draft outcome documents, that's the very first, taking that time to deliver report, and now member states, it's their job to turn that into the document that heads of government, heads of state approve on September 27th. And so the zero draft is a sort of shorter version of the time to deliver document. We're very happy that language around obesity has been maintained in there. But we have asked all of you to send letters to the co-chairs of this whole process, and those are, and we've sent those mailings out yesterday, ensuring that that language around obesity is retained, because now, between now and sort of end of July, when that document is negotiated, the likelihood is that the documents will get shorter, and whole chunks of language can get taken out. So we want to make sure that the language around obesity is not removed. It's extremely important. And so putting the pressure on now is extremely valuable and helpful, and we will continue to ask you to keep the pressure on with your own governments. The high-level meeting takes place in September, as we know. Negotiations are underway. They start actually tomorrow for the outcome document, and that's taking place in New York. So the action has moved from Geneva to New York now, and then we'll have also World Obesity Day on October 11th with stigma as the theme, but some follow up to this. And then at the end of the year, there's it says G8. I apologize. That should say G20. The G20 meeting is happening. The Lancet Obesity Commission report is being launched, and we'll also be having messaging and advocacy around childhood obesity, because that is something that the G20 is taking on. On the bottom, you see the topics I'd already mentioned. The first report of the WHO Commission on NCDs, which is the time to deliver report, and then the report of the Bloomberg Fiscal Policy Commission on NCDs is coming out, and then there was also the Bloomberg Business Case on NCDs, which was launched at the World Health Assembly. Could you keep going? Next slide. So then, I guess, just thinking forward, this is just very much sort of some blue sky thinking now, I guess I should call it. But if we wanted to, we definitely need to keep the heat and the pressure on the WHO and the UN to ensure that obesity gets the attention it needs. We know that worked very well for tobacco. The reason that we have a framework convention on tobacco control, and that there's been real activity around that in the past sort of 15 years, has been a result of WHO creating a public health treaty around tobacco, and every country signing on to it, and then implementing various articles of that treaty. So that things like smoke-free, sort of restrictions around smuggling, all of those. I think we sometimes don't realize how far we've come on tobacco, even though there's a long way to go. And much of that is the result of the world coming together, creating a framework convention on tobacco control, and then committing to that and implementing legislation over the succeeding years. In the case of obesity, the ideal would be to get a resolution approved by the World Health Assembly. And part of the value of a resolution is it kind of forces member states to make commitments around an issue, but it also forces them to really give consideration to what are the best measures. It's sort of a stakeholder engagement strategy as much as it is a political commitment strategy. Resolutions sometimes are really, really successful at making, affecting long-term, large-scale change. They're not effective if there's not a strong engagement by civil society, i.e. all of our organizations, because you need to have that consistent pressure so that something, once it becomes a resolution, doesn't just kind of get put on a shelf and forgotten. We also note that, that there are times where if a resolution comes too quickly, there hasn't been really agreement among all the players on how to operationalize it. So that's an issue. So at the same time, we think that there could be the opportunity to do a resolution around obesity, and that could be really important to us collectively. So that's just something that we'll be wanting to discuss and consult with all of you around in the coming months and years. And it would take probably, I mean, at least 3 years to get a resolution through. The only other thing I would mention is that there has been talk of a framework convention, which is more binding than a resolution. It results in actually some legally binding decisions and commitments. There has been talk at various times of a framework convention on childhood obesity. So that's coming from member states. So that's just nothing, you know, it's talk. The people that I know at WHO think if it happened, it would happen in the early, you know, sort of early to mid 2020s. But it's something to just keep in mind, because it's potentially, you know, a way for the larger obesity issue to actually become associated with a series of legally binding agreements. So these are just some of the, you know, if you look up top, those are the processes of WHO and the UN system, and below are some of the work that we're seeing happening with civil society that we just wanted to reiterate. If we can go to the next slide. So that's all. I guess now I would welcome any questions. I don't know if I'm supposed to be seeing a question screen, and I apologize if I am.
Thanks, Johanna.
Yeah.
That was really helpful, and I think it's really important for us all to have that history and context of the UN high-level meetings. I think sometimes we all kind of forget the bigger picture, so that's been really helpful, at least for me, so I hope other people agree. If anyone has any questions, please send them through now. We've got someone monitoring them. We've had a couple through already, which obviously you can't see, Johanna, but we can. So one is can you clarify what World Obesity's kind of call to action is, if you like, ahead of the UN high-level meeting, specifically on obesity? Is it simply to get obesity into the text, or are there more specific calls to action? So
yeah, no, so I think we looked at what are the kind of the political windows that are open, and how can we ensure that there's you know, without being too complex about this, because I think, you know, if we have some obesity commitments, we, you know, collectively can work together to ensure that the wider comprehensive approach to obesity can be factored into that. But childhood obesity is very much one of them, along with obesity and universal health coverage, which is both the latter is in recognition of obesity as a disease, and in wanting to ensure that as countries come up with standard sort of models of what universal health coverage would look like for their country, and some countries have that fully realized, some are sort of halfway along that journey, and some are just getting started, that there would be an assurance that health systems, and preferably and ideally, you know, starting with primary care, would be looking at overweight and obesity in the health system, so that's addressed. Because if we don't advocate for it now, it will only be, you know, sort of, it will be very haphazard how that might get adopted. So obesity and UHC and childhood obesity are the main priorities, and then we're also focused on sort of ensuring protection around the commercial determinants, which would be around issues like taxing of sugar-sweetened beverages. To that latter point, I just want to make one mention that our colleagues at the World Cancer Research Fund, who many of you know because they do some really great research and analysis around obesity, have just come up with a new report around kind of a how-to guide for sugar-sweetened beverage tax. So I would just go to their website, WCRF, I think it's .org.uk, I believe, and download the report that they've issued around sugar-sweetened beverages. So.
Okay, thank you. We've had another question in. If there was one kind of action that you would ask of our members or any other civil society organisations between now and September, what would that be? What can people do to kind of get involved?
I actually think, well, I think that the note that we sent out yesterday, and this is, so we've asked you to actually email the UN ambassadors from Italy and Uruguay. So they're both based in New York, the ambassadors to the UN, because they're the co-chairs of the UN high-level meeting on NCDs. So if you can just, what we need to do is we need to kind of not consistently bombard them, but we want to get this language in front of them now while this outcome document is being negotiated. And the language, again, is very much, keep obesity language in, and a few other points around obesity. So that is the single most important thing that we can all do, because I think we've already seen it works. Having, that the same message come from lots of different places and lots of different organizations is a very, very powerful tool. And then just, keep in touch with us and kind of watch this space. If there are, there may be issues that come up where we'll ask you to reach out to decision makers. Certainly, please tweet about this. Use the hashtags we've provided. Go to the microsite that we have under #ObesePlanet to see different materials that you can use, because I think social media is from my perspective, since it's 7 years since the 2011 meeting I was very involved in, it's interesting to just watch how far social media has progressed as a really important tool in all of this. And so please use your hashtags widely and well. Thanks.
Thank you, Anna. I think actually that is a really good point to hand over to Lucy, who is managing our Obese Planet campaign and is going to tell you a bit more about how you can get involved, the resources we have available, and just, how you can support our work moving forward. So I'll hand over to Lucy now, and if any more questions come up, we can address them at the end. Thank you, Anna.
Good afternoon. So I'm Lucy Keithley. Thank you for joining this afternoon. Hopefully the next sort of 5 to 10 minutes can put some flesh on the bones really of what Johanna was talking about in terms of actual actions and how you can physically get involved. What we've done here to hopefully make things a little bit easier for you is come up with a microsite where basically we're hosting all of the campaign material that's to be used between now and the meeting in September. There's sort of several points to it. If you go on, it's quite an interactive site. It talks about the 3 main key messages that World Obesity Federation are looking at, and then it actually goes into more detail in terms of practical things that you can do in terms of taking action. So what you'll see, all of these links, by the way, are going to be available afterwards, as will the slides, so you don't need to worry about jotting things down now. But if you go onto this website, it basically walks you through, like I say, the key messages and then actions. And then if you go on to the next slide, go into the resources page, it actually then talks specifically about things you can do. So just as an example, I think one of the things that Johanna probably referred to earlier, there's template letters in there that you can use to send to your in-country delegation with reference to the UN high-level meeting in September. There's also the World Cup campaign, which Johanna again has just referred to, whereby it's a little bit of fun, but it's been quite useful in terms of getting some media attention. There was an article, I think it was in the Telegraph, that there is a link to later on, which talks about the countries that are actually taking part in the World Cup and where their position is in terms of obesity and rates of overweightness in their particular country. And it's quite worrying reading, to be perfectly honest, but it just puts a different spin on it, and potentially it's a way of getting some more press and media in your own localities. We've also put on there, under the resources section, documents and statements that are relating to the UN high-level meeting. It's just a good place to go to in terms of being able to find information really quickly. This is just a screenshot. This should be going live by tomorrow morning. The information's actually on there, but we've actually now color coded it. So green is basically things that you can do. So you can go on there and see the scorecard and see how that works as an explanation to that particular campaign. There's some social media guides around Obese Planet and how you can use that in terms of social media. And then, like I say, letters, template letters. And my eyesight's not good enough to read the last one, but there's another point on there. And underneath, like I say, are the statement documents and some useful links to other advocacy documents that you might want to easily be able to reference. This is just a link on here that will take you through to that article that that Johanna was referenced in. I think it went out a couple of weeks ago now, and just some useful facts in terms of where your countries might sit in terms of the Obesity World Cup, as it were. Sorry, next slide. One of the other things that we just wanted to touch on very quickly, obviously World Obesity Day is on the 11th of October, and the topic this year is going to be stigma, which I think Johanna mentioned earlier. The team's currently working on obviously getting things up to date and out. So shortly we'll be communicating with you in terms of the microsite and toolkits and all those other good things that go with World Obesity Day. There is another thing that we are hopefully going to do on the 10th and the 11th of October, which will be hosted in London. And that's to bring together a global delegation selected through our membership to actually come together for a summit to talk about patient advocacy on a global platform. There will be, it is kind of early days in the sense of we're just pulling together what that's actually going to, shaping up what that's going to look like. But if you are interested or you have members of your organisations that are interested in that, if you want to just drop us an email to Fiona here at World Obesity, then we'll reach out as soon as we've got the criteria and all the other information around that. But it will be, the dates are definitely the 10th and the 11th of October in London. There will be funding to get people here and things like that. But if you're interested in that, we'll be really pleased to hear from you. So really just to summarise, Obese Planet is kind of the one-stop shop. As we have more documentation, or if there are any more papers or calls to action, everything will go on that website. So it's definitely something to make sure you've got on your desktop. And there's some other useful links just below here, as I said, which can be made available for you after the call. If anybody's got any questions, then...
Thanks, Lucy. That was really helpful and a really good supportive presentation to Johanna's, a bit more on a practical level, what people can do, how they can get involved. And I think just from our perspective at World Obesity, I think what's really key is that we're advocating at a global level, and where you can all get involved is the national advocacy, supporting our messaging, talking to your media in the countries that you're working in. And I think if you have kind of any ideas, or if you want to build on any of the work that we're doing at a global level, please do get in touch and we can work together to kind of get advocacy going. If you have any contacts within government that you want to get in touch with, come to us and we can discuss how we move forward together. So I think this is a really good opportunity for us to work together at a national and at that global level. And just to say, the links have been put in the webinar chat, and also you had them on the slide. So please do have a look at the information that we've been sharing, because I think it's all quite interesting and relevant for our work moving forward. I haven't seen any questions for Lucy. I did have one question come through for Johanna, if he's still there. Basically, with the UN high-level meeting, what does sort of a successful UN high-level meeting look like in terms of NCDs generally, and also for obesity? Obviously, you mentioned getting some language in, but what are we looking to see sort of after the event?
Well, I think. Thank you for that. It's a great question, and I think that success would be probably. Catalytic funding is one of them, and I would say that there's probably a few different kinds of funding. There has been discussion of sort of getting major donors and development funders to support a sort of a trust fund. not really fully a global fund, but a trust fund to help launch this. But then catalytic funding, recognizing that a lot of the burdens in middle-income countries, where it's probably a bit more almost about reorienting health systems than it is about going down the road that had been appropriate for infectious disease, but it doesn't really make sense for NCDs of having a lot of funding coming in externally. I think there's a recognition we want to have integrated, functioning health systems that address the burdens of their population, and by doing that, they're going to address the fact that 70% of the people in the world now are dying of NCDs, and that 4 million deaths each year are driven by obesity. So that in and of itself, like funding commensurate with which again goes to universal health coverage too. So it's that catalytic funding to help countries build universal health coverage that's responsive to the actual pressing health needs of their population. So I'd say that the funding piece is really important, and kind of sustained high-level commitment. So, and I would almost call that in some ways a healthy level of peer pressure across heads of state, where they start to be measured on how they're doing on NCDs in general, and by definition, that's going to include obesity. From our perspective, I think also just strong language around obesity with tangible policy next steps is key.
Thank you. That's really helpful. And I think it's good to know what's beyond September, because sometimes we can just focus on September, but it's good to know kind of what the bigger picture is and what we should all be looking out for.
Yep.
So there's no more questions. So I think we'll bring today's webinar to an end. Thank you so much for joining us, everyone. And thank you to our two speakers. I hope everybody's found this really helpful and has provided you with a bit more background to the UN high-level meeting and how you can get engaged moving forward, and also what the UN high-level meeting means for obesity specifically. Further information about all of the projects that we're doing more broadly and opportunities to engage with world obesity were included in our Members in Action Initiative newsletter, which went out yesterday. If you didn't receive it and would like to, please get in touch with Fiona and we can get you on that mailing list. So thank you again for joining us, and we'll communicate with you soon. Thank you.